Guys, we are live at Fredrickson Health Solutions. Today we have two very special guests, Dr. Natalie and Dr. Billy Ledbetter. Today we're going to be talking a little bit about some newer subjects, including peptide therapy and a little bit anti-aging as well. Dr. Billy and Natalie have 4 clinics now, and they have some really exciting stories. So if you guys don't mind, go ahead and introduce yourselves.
Sure. I'm Dr. Natalie Ledbetter. I have a doctorate in Chinese medicine and acupuncture, and I'm also a nurse anesthetist, so I do anesthesia, and married to this awesome guy here, and I'm really super passionate about helping people live as long as they can with vitality and vibrance and passion and health.
And I'm Dr. Billy Ledbetter, and I'm your traditional MD who doesn't really practice like a traditional MD. I've been doing kind of wellness, anti-aging, what they call functional medicine these days, for about the last 20-something years. My career track has been very off the beaten path. I'm a Navy jet pilot and a whole bunch of other things. So anyway, and I'm married to absolute wonderfulness right here.
Yes, Natalie is a great name. It's the same name as my wife. So it was like we're connected. And I just have a funny story about how I first met you guys. Well, one is with you, and it was at Alive and Well. And I was getting an IV, and there was a lady who was very hesitant, and she was asking all these questions. And I was just thinking to myself, man, Dr. Ledbetter, he just handled this lady with such, such great bedside manners, such politeness. And I mean, this lady, I don't know if you probably remember her, because and she was just like, can I see the needle go in your arm? I was like, okay, lady, like, you're kind of freaking me out. And my wife, I had rhabdo at the time.
Yeah. So
I had rhabdomyolysis, and I had all the signs, symptoms, the dark urine, and I was getting that IV from Dr. Ledbetter. I mean, I drank like 4 gallons of water, and my wife's like, there's no way you cured your own rhabdo, but I think I did.
Wow.
So pretty interesting. But enough about me. So I want to talk to you guys just about how you guys got started in anti-aging. I know you guys are way ahead of the curve. I know last time I came to y'all's office, y'all had some glutathione and some other IVs going through you guys during our meeting, which was awesome. So how did you first get started anti-aging, and tell us about that?
I guess I'll start that off.
Yeah.
So a lot of my ancestors and grandparents lived to be over 100. So from an early age, I've always said, I'm going to at least live to be 100, at least, minimum. As you get a little bit older, you start to realize that, if I'm going to make it to 100, but I'm going to want to make it to 100, I might have to do some things. So as he said earlier, we've been doing some alternative things for a lot of years. But once we hit our 50s, for me, 50 was like, like a wall. Like, you're going along great, and then wham, things stop working. You have to work harder. You try to work out, and you think, I'll just go run a mile. How hard is that? And then halfway through it, I'm dying. So that really stimulated more of trying to look into what else can be done, anti-aging, biohacking things, so that we can live to 100, 120, 150, and want to live to 120, 150, and be healthy all the way there.
I got goosebumps. That's awesome. What about you, Doc? Same
well, like I
philosophy.
said, I kind of went down a little bit non-traditional path. I started out in general surgery, but that didn't work out. It was kind of a change the job or change your wife. I decided to keep the wife, and we've been happily married for, mostly happy, for 31 years now. So it worked out well. It was a good decision back then. I joined the Navy as an aside from that, and when I joined the Navy, I met an osteopath, and he was very much into holistic health. And he and I spent every day together pretty much in the clinic, and we would talk, and he got me started down, as simple as it is, the Myers cocktail, which again, Myers goes back to the 50s, and it's vitamin C and zinc and a few other minerals and stuff. And I thought, that's really cool. So as I progressed along, I kind of got into the, sick care is really what we're all about in the allopathic world. And it just didn't make sense to me. And just like Dr. Schallenberger says, the best cure for any disease is to not to get the disease to start with.
Right.
And so that's healthcare. So real healthcare. So keeping people healthy. And then that just kind of opened up the, Pandora's box, if you will, of, well, what can we do to do that? And oh my God, it's like in the last 15 years has just really exploded with all the different things that you can do to kind of help your mitochondria, your cells, and everything else function best.
That's awesome. And do you think today, now more than ever, people should be looking more to these functional medicine or fringe, what was originally called fringe healthcare now? Because Myers cocktails, we're seeing it on the news. We're seeing about, intravenous vitamin C. We're seeing like glutathione injections. People are like, what is that? Everyone's like, what can we do to make our health better? I mean, what are you seeing now? Are you seeing your patients come to you and say, hey, can I get this, doc? Or are you seeing more of that?
Oh, absolutely. Yeah, like so 25, almost 26 years ago, I was the kind of the redheaded stepchild out there. Like, even my best friend, God bless him, I love him to death, but he just thought I was a complete idiot. Just like, that stuff doesn't work. It's not proven. It's not, there's no double blind, placebo-controlled studies and stuff like that. But now we finally are starting to get the science to back it up, stuff that, some of us have been doing for 20 plus years and have kind of already known that it helps, even if it's subjective and hell, even if it's just placebo effect. I mean, it's a real effect. You get real cellular change. It works. So I've known that, but now we've got science to back it up. So that's why you're starting to see a lot more places and a lot more allopathic doctors, which is your traditional MD, coming on board with this sort of holistic, even functional medicine kind of program, alternative medicine, if you will. I think it's all kind of a alternative medicine umbrella.
Right. Love it. Love it. So I want to talk a little bit about peptides. And for people who aren't new or aren't familiar with peptides, what is it? What kind of benefits do people expect? And how does it differ from some other things that people might already know about, like PRP, stem cells, or hormone replacement? How can you explain those and some of the differences?
Sure. You want to take a run at it?
So all peptides are just chains of amino acids, and we know proteins are larger chains of amino acids. So peptides are signaling molecules that go into the body and work on receptors that already exist and tell the body to work in a certain way. So a lot of times as we get older, our receptors will kind of downregulate and they'll get a little rusty and they won't work as well. So you give a peptide to send it in there to go sit on that receptor and go, dude, wake up. And so you're just using the processes that are already in your body, using enzymes that normally are already in your body, but we can create them in a lab and then send them in there to go tell the body to do what it's supposed to do.
Awesome. Very cool. And have you guys played with anything else before peptides? I mean, or PRP or anything like that? And how does PRP and peptides differ for someone who has no background knowledge?
Did you take that?
Yeah.
Yeah. So PRP is platelet-rich plasma. And what that is just a component of your blood. So when you pull out blood and you don't let it coagulate or gel or clot, and you spin it down, you're left with plasma. And inside of that plasma, right at the very bottom of that plasma, after you spun it down, is this platelet-rich layer, okay? That platelet-rich layer tends to have a lot of what we're talking about, peptides and signaling molecules, that will help your cells kind of wake up and behave, like Dr. Natalie said. So the way that the peptides we're talking about now differ is that we are taking it's not synthetic because it's amino acids, it's real amino acids in a very specific chain, a very specific length, and just kind of tailoring that to specific receptors. And what that does is it helps your cells function better.
Right.
So I think the difference to me when I look at PRP and peptides is that PRP, you're only going to get to use what you have in there, right?
Sure.
So you're drawing off your blood, you're spinning it down, you're taking that conglomerate of platelets with their healing factors, but you only got what you got. And the older you get, the less you have.
Sure.
So, and it's not super specific either. You're putting some growth factors in there and you're stimulating the body to heal itself. But with peptides, you can say, I want my body composition to change. I want less fat, more lean muscle, and I have a peptide or two that goes in there and it sits on those receptors and it tells your body what to do, increases your growth hormone. So you're being very specific with what you want, which is exciting.
And who doesn't want that?
I know, right? Yes. Especially after you get 50.
Right.
Wait till you get 50.
Yes. Yes. And I mean, I've been around this field for a while. I've seen the shift, go from PRP. PRP is still used all the time. Mm-hmm. First was prolotherapy, right? Then I went to PRP, stem cells, peptides, and now exosomes, right? So
we love them.
And we do all of those.
We love them
all of those. Okay.
Yes.
Maybe for stem cells and peptides, could you maybe kind of compare those and how they differ a little bit?
Well, yeah, there's a whole lot of difference there. The stem cells, backing up a little bit, the reason we're using exosomes more right now is the stem cells contain the exosomes. So the new science is starting to feel that stem cells actually work by the amount of exosomes that they carry, signaling your body and your cells to do what they're supposed to do more optimally. My original understanding was, I thought stem cells, if I inject, like, say, umbilical stem cells in myself, which I've done, they divide and they make me younger because they're stem cells and they're dividing. Well, they show that it actually doesn't happen that way. But the contents of those umbilical stem cells are very new, and they're considered adult stem cells, but they're brand new. Whereas my 54-year-old stem cells are 54-year-old stem cells. So the contents of those cells are 54 years old with all the oxidative damage and reactive oxidative species and everything I've done to it. We kind of alluded to earlier, you know, kind of pickling the brain sort of thing.
Right.
But if I take umbilical stem cells, now I got new products in there, and those new little exosomes and stuff that go out and say, hey, you need to behave like you were designed to behave. And so it kind of wakes up your system, revives it, if you will. So it's not like the Fountain of Youth or a Benjamin Button kind of effect, but it is a optimizer, if you will. It optimizes the way your body already behaves.
Decreases inflammation.
Right.
So it's also a little more generic or general.
Right.
If you're IV infusing exosomes,
Sure.
where it just goes, and they do cross the blood-brain barrier, which is pretty awesome.
Mm-hmm.
So you're kind of getting a general all over the body effect, unless you're injecting them into a joint or something, then you're getting a localized effect. Whereas peptides, you're still getting a generalized effect, but you're targeting a specific thing.
Right.
Like there's a DSIP, deep sleep inducing peptide that actually they use it for a lot of other reasons, but it was originally designed to target deep sleep.
That's awesome. So you're saying stem cells already contain some exosomes, but when you're using a peptide that's specific, you're getting a lot more. Is that right?
Not a lot more peptides, but well, yeah, actually you do, because the exosomes contain a goodly amount of, I mean, they're microscopic.
Sure.
I mean, they're like at the subatomic level, or not subatomic level, but at the nanometer level, and they contain thousands of different peptides. Some of them do. So yes, you're getting a lot more peptides that were generated from a very young individual. And
you're just not choosing which
you're
peptides.
just not choosing which peptides. Whereas with peptide therapy, you're, like Natalie said earlier, you're selective. You're being very selective about which outcome you're kind of trying to drive. And, you know, the human body is very complex. It's all of the metabolic pathways are interrelated in some shape, form, or fashion somewhere down the road. They all kind of feed off each other and contribute to each other's working. So, yeah, but peptides, the peptide therapy we're talking about today is more of a very specific target that we're looking for.
Awesome.
So we do both.
So y'all do
So
both?
we do both.
Yeah.
Right, right. And so you mentioned weight loss,
Mm-hmm.
vitality. What are some benefits that people can look for, Dr. Natalie, and what have you seen in your clinic and personally by using peptides?
I love peptides so much because I think I mentioned earlier, after you get to a certain age, it seems like things don't work the same. And for women, I feel like we start to have a harder time losing weight, and we eat really careful. We do intermittent fasting. We're now doing keto, but especially women can get to the point where you do all the right things and you're not losing weight and you're
Sure.
putting a little weight around the middle. So there are peptides that you can take that will actually change your body composition, that will actually help you to lose weight, and it will actually ramp up your metabolism a little bit, and it will help your body to secrete more growth hormone. As we know, as we get older, you know, we have all this growth hormone when we're young, and then it kind of so we're using peptides to bump it up just a little bit to get back to where we were when we were at our peak, when we were at optimal, just to give us a little bit more so that we have a little help. And for myself, I was kind of plateaued at a certain weight for probably 3 or 4 years, and I started eating less and less and less, and extending the intermittent fasting period longer and longer. And I was like, I'm not losing anything, and I'm trying harder, I'm working harder,
Right.
working out more. And so it kind of gets frustrated after a year or two of eating less and less and working out more, and you're still like, what's going on? Within a month of starting the peptides, I've lost 3 or 4 pounds, and not doing anything differently. My ability to run, we like to run trails, has increased so much. I mean, I still sound like a dying cow, but I can make it a lot further with a lot less suffering, and my muscles are getting better. Like before, I was pretty pitiful at doing push-ups and stuff, and I'm getting better. So I'm super excited, super excited.
So cool. So have you guys tried all these peptides on yourselves personally that I'm about to ask about?
Yes.
Yes. Okay. Well, let's start off on the ones that you're taking, the ones you've seen for weight loss. Okay. I know that's a big topic right now. Everyone's at home. People are having food available 24/7, and people are drinking more alcohol than ever before. So what kind of peptides would help with weight loss specifically?
My favorite right now, there's a few, but the one that I've seen the most results personally and that I've heard of in other people is a combination of 2 different peptides,
okay.
CJC 1295 and Ipamorelan.
Okay.
And the reason we use those 2 together is that if you use each of them separately, you'll get an effect. But if you put them together and use them at the same time, you're going to 5 times your effect. Wow. Because of the synergistic effect. So they both work on the pituitary, CJC 1295 and Ipamorelan, to increase the pituitary's release or secretion of growth hormone. So as we're increasing the growth hormone, then it's like, you know, there was a big craze years ago about bodybuilders and stuff taking growth hormone.
Yeah. Oh, yeah.
But then they had a lot of side effects that were not good.
Right.
So this, you're just stimulating your body to produce and release its own, but you're just giving it a little help. You know, you're kind of pushing on the throttle a little bit. So then you get those good effects without the bad side effects.
Right. And you don't shut down your body's endogenous production by using things like peptides, right?
Right. Now
as long as you use them responsibly.
Yeah.
Always see your doctor or your healthcare practitioner first, right?
Because if they're not used correctly, then you can downregulate those receptors, and then all of a sudden you're not getting the effect, even if you're taking the peptides, and your body has already said, hey, I'm getting this from outside, so I don't need to make it anymore. So it's shut down too. And it takes a while for that to come back. So yeah, it has to be done in a responsible manner.
Right.
We cycle almost all of our peptides for that purpose, so that your body, you're helping it a little bit, but you're never getting it to where it gets lazy and downregulates the receptors. You always want your body to have to work, right?
Right, of course, of course. And it's weird. I think my phone's listening to me because as soon I had you guys coming on, you know, I pulled the audience like for some questions, and I'm starting getting ads now for peptides.
How funny.
Yes, and I'm getting ads from other companies, but like you guys said, it's complicated. The body's complicated. It sounds like you would need to see probably a doctor personally rather than just order these off the internet, right? So
that would be a smarter thing to do, I think. I mean, me personally, of course, may be a little biased to being an MD, but at the same time, there are a lot of horror stories out there. And we also know, Natalie and I just had this discussion yesterday about supplier. Okay. I mean, I'm having a harder time getting what I consider to be reliable supply of these peptides. Most of those that you see when you go to Google and you Google peptides, 90+% of those are made in China. And I don't know how you feel about that, but there's been some very interesting reports of some kind of sketchy things going on in that realm. And so I like to have trustworthy, reliable, reproducible sources, and the ones from China have been proven multiple times to not be that. It's not that they necessarily make a bad product. It's just that
you don't know.
They're not. You just don't know what you're getting, and you may order the same thing from the same place 2 different times, and you'll have 2 completely different products. And there's been studies that show that.
Well, even in Chinese medicine, in school, most of my instructors were Chinese. And they said, I wouldn't buy herbs or things like that from China because you don't know what you're getting all the time. They may be contaminated with lead. You may get something that you don't think that you're getting. There was an actual study where there was a growth hormone that was released from China, and people were buying it in the bodybuilding community, and they were having good results. It was fantastic. And so after about 6 months, all of a sudden they switched the formula to a growth hormone that wasn't even like a human growth hormone, and a lot of bad things started happening. But
still labeled the same, still sold the same.
Exactly. So you don't know what you're getting. So you have to be really careful. And then we had about 4 years ago a client who was a bodybuilder who was using a lot of different peptides, and one of the peptides that he got from some source out there on the internet just trashed his body, and we spent 2 or 3 years trying to build him back up. to figure out how to fix him. And really, he's still struggling today.
Right.
Like, whatever the peptide was, we don't know what was in it. It was not a good thing. So I think people should be really, really careful.
Right. And the same thing with the supplement industry, like vitamins and supplements. Like the company I work for instance, has a China last policy. Like we very rarely get any raw materials from there because you can have one potency of 90%, next potency could be at 40%.
Yeah.
And so we don't want, that's just a mess we don't want to mess with, because we work with practitioners like you on a daily basis and your reputation's on the line. So we have that policy in place. So that makes sense. So guys, anyone listening, go to your healthcare practitioner, go trust, but verify, make sure that your doctors are using the right stuff. Don't just go on the internet and find something for the cheapest price, because you get what you pay for, right?
Yeah.
So,
and you're injecting these things into your body.
Right.
Do you want to inject something into your body that possibly could be contaminated with bacteria?
No. Arsenic
or
lead.
Yeah. I am all about saving a buck, but when you're talking about your body, if this has to last you for 80, 90, 100, 120, 150 years, I think it's worth paying a premium to make sure that you're getting a premium product. If you're going to be injecting it or ingesting it, make sure you get what you think you're paying for.
Right. You wouldn't put just regular unleaded gas into a Ferrari, right? So your body's kind of the same analogy. So is there anything else we need to add for Ipamorelan and then the CJC 1295 peptides for anyone listening?
Well, we can just real quickly talk about some of their benefits. So increased lean muscle mass, decreased fat, increased ability to heal after injury or exercise, increased quality of sleep, increases the ability of your receptors to respond to insulin. What else are some really decreased inflammation? There are a couple of other good ones.
Yeah. Of course, my mind goes to the, it is a IGF-1 inducer. So, and that's a kind of an inflammation marker that we use sometimes to kind of look at inflammation. So when the growth hormone dumps from the anterior pituitary and then the liver secretes the IGF-1, it's a signal to the body that says, hey, look, we need to grow. We need to build new cells. We need to build, muscle and everything else, just like Natalie said. But that can also be necessarily bad. So if you're not careful with it, because
of mTOR or?
Well, it upregulates mTOR, right? So that's what IGF does. So if you really want to start getting down to the weeds, I'll geek out on you. Natalie, she hates it when I do that, but so I won't do that. But yeah, if you want to talk about the PI3K and the protein kinase B mTOR pathway, we can dig into that later on if you want. But it all gets upregulated with growth hormone and IGF-1. And in doing so, the body's saying, look, I want new muscle, I want bigger cells, I want new, fresh cells and stuff like that. The caution is that it can bite you if, say, there's this mutated cell that's sort of hovering in there. It gets the same signal. And it says, hey, let's grow.
Sure.
So now you got this mutated cell, and we call that cancer. It's just your own cells gone awry. And now we're feeding it extra, kind of signals to grow and expand. So you have to be a little careful with it. And that's why it's important to go see your medical provider before you do that.
Get the right dose as well.
Exactly.
But, and then we'll see, it's just, it's kind of got a little bit of an inflammation kind of side effect from growing so rapidly. Okay. And there's ways we mitigate that as well with the glutathione and stuff like that. Right. But anyway.
Some anti-inflammatory effects too, if you don't go crazy with it.
Yeah. And it has to be in the right dose and has to be,
I've noticed increased physical performance and increased mental performance too, like sharper mind.
Yeah, it does help with cognition.
Yeah, definitely. So I like that. Now, the one caveat is that it can increase your appetite. So, you think about it, it's telling your body, let's grow.
Sure.
So you need food to grow. Now you're supposed to take these at night and you need to take them on an empty stomach. And we were like, why do you need to take them on an empty stomach? Because you're injecting it as a sub-Q injection. Like, why does that matter? But because you don't want to have a big high insulin level, because you're trying to take it at night when it's the body's normal time to increase your growth hormone. And during REM sleep is when the pituitary typically is kind of naturally surging that growth hormone. So you're trying to follow that natural circadian rhythm. And then you don't want high insulin levels because they kind of counteract each other, the insulin and the growth hormone. But I have noticed that I'll take it and then I'll be laying there and I'm like, oh, I'm kind of hungry.
Oh, at night, yeah.
Yes.
Have you found it's better to maybe take a little bit of fiber before bed or anything like that, just to measure or help mitigate some of the cortisol and blood sugar rises?
It probably would help.
Well, that's the beauty of the Ipamorelan, though, is that it's a growth hormone secretagogue, but it doesn't have the same, like Semorelan and Tesamorelan are very similar growth hormone secretagogues, but they cause the adrenal to dump that cortisol and what else, the ACTH and the prolactin. And so you don't get that with the Ipamorelan like you do with Semorelan and Tesamorelan. So no, I haven't tried fiber at night. I haven't really done any of that to try to offset, or because I don't find that ghrelin agonist activity to be as pronounced in me. So I haven't tried it.
And because of our intermittent fasting, we try to have a 16-hour fasting window. So the later we consume any food or anything, the longer we have to fast the next day. But I mean, that could be, it's not that bad for me. I haven't really noticed a problem with it.
And just to talk about that for a little bit, do you recommend maybe like a time restricted eating window? Because we know that mTOR is going to, or IGF-1 and mTOR together are going to help increase growth. But then we need some time to help kind of rest,
heal,
autophagy, those sort of things. So do you recommend, if people are doing peptides, to have more of a tighter eating schedule, so to speak, or does that matter?
It definitely help. I mean, if you're looking at general overall health anyway, depends on probably which peptides.
Everyone's different, right? Everyone's different. Peptides are all different. But I was just wondering, if we're trying to induce growth, right? Trying to put on some muscle, maybe we should have a couple hours in the day where we're not.
Yeah,
stimulating.
Especially if
those
you're
same
on the
pathways,
CJC
right? So,
Ipamorelan, it totally makes sense to do it.
Which is why you cycle it too. So you don't take CJC Ipamorelan every day. All the time. You do cycle where you do like 5 days on, 2 days off. So you give your body that little bit of rest. And during that 2 days, and especially with us, because we already know that intermittent fasting downregulates mTOR as well. But during those 2 days, as long as you're not, like eating a lot of processed foods and crap like that, you'll get down regulation of that mTOR that got upregulated with that growth hormone kind of surge that you had during those 5 days. So you kind of it's a good balance there.
Nice. You could look at rapamycin, but we're not taking that right.
That'll be in the next podcast.
Rapamycin's a whole nother ballgame, and yes, you could do that, but anyway.
Awesome, guys. So let's talk about BP 157. This is one I'm a little BPC 157. I'm sorry. This is one I'm familiar with a little bit, just being in sports medicine as a chiropractor. I had a patient come to me about a long time ago, like 6 years ago, and he was injecting BPC 157 into his ankle. No medical background at all. He got it, off the internet, and I was
into the joint itself.
Yeah. And so thankfully he was seeing benefits. I was shocked when he told me. I was like, I think you should go somewhere else, to get some guidance on that. But he said it was helping him. So do you guys explain that for anyone who's got some joint issues and maybe some osteoarthritis, how that can be beneficial?
It's a great anti-inflammatory. I mean, it's a pretty small peptide. It's like 15 amino acids long, and it induces like angiogenesis. I think they don't really understand the mechanisms real great, but like VEGF, the vascular endothelial growth factor, gets upregulated in those. They've also shown in studies for any kind of like tendon tear or muscle tear that at least the animals, the rats that they did the tendon studies in with the BPC 157, you actually get tendon fibroblast outcropping from the severed ends of the tendons. And given enough time, and they actually have mended, and then they did strength studies on them, and those areas where it mended were just as strong, if not stronger, than the original tendon. So it was like, that's impressive. I mean, it's like really, and I've noticed, me personally, I think I might have torn my rotator cuff. I'm not exactly sure, right before this whole COVID-19 thing kicked off. So, and I don't know what I was doing. It was very innocuous, kind of whatever it was. Just one day I was like, oh my God, and it hurt like hell. And ever since then, it could be from the fluoroquinolones I took last year for prostatitis.
Oh, okay.
Yeah. So we already know that that's increased risk. So I may have torn a tendon or whatever, but when I'm using BPC 157, I can't lift because I'm afraid to, but because it does hurt like hell. But it helps with the inflammation. Like, I have no pain right now at rest. I can still have some range of motion without any sequelae at all, as opposed to without it, Like if I go 4 or 5 days without it, I'm like, I'll reach for something and it'll just almost drop me to my knees because it hurts so bad. So it works well. I mean, BPC 157 is awesome.
It's been shown to work on tendon to bone regrowth, healing tendons and ligaments. It also is shown to have organ protection. So really where they discovered it was in the gastric juices of humans. And it has a protective effect. So any kind of GI problem like leaky gut, Crohn's disease, IBS, severe abdominal cramping, it can actually heal.
They've actually used it when we do surgery, do end-to-end anastomosis when we do a bowel resection. And we put them together. They've given them oral BPC. We take ours injectable, but they have an oral formula as well. And what is it called? It's a body protective compound.
Complex.
Yeah, complex compound. But that's what the BPC stands for. But there's an oral prep that you can take, and like she said, Crohn's, inflammatory bowel, and they showed in this end-to-end anastomosis that it healed those really well. So this is pretty amazing stuff. I mean, this is
it's exciting.
Yeah, this is kind of the Wolverine, heal like Wolverine kind of medication, as I heard one person say. And I was like, that's kind of interesting. And it's not quite to that degree, obviously, but still, it's pretty phenomenal.
Right. And just when I was growing up, I had sprained my ankle when I was 16, real bad. And since then, I'm not kidding, 200 to 300 times later, I've sprained it.
Yeah.
And we know from studies that if you sprain your ankle once, you have about, I think it's 75% chance that you'll re-sprain it in that same subsequent year. So things like BPC 157 seem like they can help accelerate some of that healing time to these areas that are usually avascular maybe. So, I mean, I think this is kind of going to be one of those things that we're going to start to look at more and more. And is BPC 157 cheaper than, say, stem cells?
Oh, yeah.
Yes.
A lot cheaper.
I think everything's cheaper than stem cells.
Right.
Stem cells are expensive.
Right. So now with BPC 157, a lot of podcasts out there say that you have to inject it locally. And so when we first started using it, we did that locally. So, and we still inject it locally in his shoulder, but studies have shown that it gets intravascular anyway, so you don't necessarily have to do it locally. But as an acupuncturist, I'll take the BPC 157 and I'll inject it in specific points in the acupuncture channels related to. So I have 52-year-old eyes and I love to read and my eyes get tired and fatigued. So there's a couple of spots in Chinese medicine that are related to increasing the vision. And so I will probably every other day or so, I'll inject these spots with BPC 157, the acupuncture points. And I will notice the next day my eyes will be much less tired. I won't have as much fatigue. So I'm super excited. I want to do some sort of study on it to see like actually getting that compound in an acupuncture point to get it to flow along that acupuncture channel can have far-reaching effects. It's just super awesome.
So just to clarify too, we inject around my shoulder sub-Q, not into the shoulder joint. So we haven't tried that yet. We probably could, but without an ultrasound and without so it's just easier sub-Q to kind of keep it. And like I said, it makes sense. It makes sense doesn't matter where you put it, it's going to go systemic and it will do its magic systemically. And I just, the psychology of it is, well, if I put it close here, it'll get here faster, which is kind of silly, but anyway.
It makes sense though, because some areas
don't
have as much blood.
Got to put it somewhere. So
I was injecting it into my Achilles after we do trail running, and my Achilles were hurting. But then after reading the studies saying, no, you really don't have to put it exactly in the area, I was like, oh yeah, I think I'll stop injecting it because that hurt a little bit.
That's awesome. And so, if I was a patient coming to you for BPC 157, how often would I be doing it, and how quick are the results?
Probably do it daily until you
Depends
saw
on the
results.
injury.
So maybe
daily for
2 months, maybe.
Daily for 2 months,
maybe.
Okay. Very
if you needed it that long, most people don't.
And a lot of it is it self-guided. Like you would say, hey Robert, you're going to take this home and do it, or I have to come to the office to do it.
If you don't mind sticking yourself.
Right. Okay.
Yeah, you have to not be shy of needles, and because it does require a little tuberculosis syringe, and then with you draw up needles so you can draw it out of the vial, and then putting on a little bitty TB needle so you can put it. And then I just prefer my belly because it's maybe because I'm a little extra in that section, so I don't feel it. Doesn't even hurt at all. I don't even feel it 99% of the time. I've seen Natalie kind of, pick a little sub-Q spot on her thigh. I mean, anywhere that there's skin, basically, put it anywhere.
Right. It's a small gauge
as long as
needle.
it's a very small
Okay.
gauge needle. So as long as, if you put it in the skin, the blood's going to flow there. It's going to pick it up. It's going to distribute it systemically. So, but for you, if you came in, I would say, yeah, you're going to do about 300 micrograms, and you would do that.
300.
Yeah, and you probably do
Once
that
a
every
day.
day for, until you either are healing. I think with me anyway, I noticed it within 12 hours
Wow.
that it was like the pain that was there just at rest, and even the pain that, like, if I did this would really hurt, but now I don't have pain at rest, and I can do that and not feel it. Now, if I try to go over my head, we got a whole nother ball game and a whole nother conversation going
Sure.
on. But, so it works pretty quickly. And then, we try to, until you're healed, you keep doing it.
Probably for
Up to
your
about a couple of
ankle
months.
around for 1 month or 2 months.
1 to 2
Probably
months.
mhm.
And would you say doing like physical therapy with the BPC 157 would have more accelerated results? Kind of going back to that Davis's law, tissues remodeled based on the stresses put upon them.
Oh,
So
yes.
do you think that would kind of help maybe?
Certainly, absolutely.
Very
Yeah,
cool.
for sure.
Awesome, guys. I'm probably going to have to get some BPC 157 for myself
Yeah.
soon. And I'll help you with the
We can
shoulder
hook
with the
you up.
exercise.
Yeah.
Awesome.
I got to wait till the tendon heals first. That's what
Yeah.
the tendons right now, it's growing together. I know it's healing itself. So
You just
Yeah.
got to baby it for a little bit.
Okay.
Yeah.
Okay.
But then you're going to need that physical therapy.
then I'll need the physical
All right.
therapy.
Anything else we want to add to BPC 157?
Oh, I think that's good.
I think it was pretty good.
Awesome. Okay. Let's go into peptide, thymosin, alpha, and beta 4.
Well, let's do beta 4 first, because
Okay.
it ties in actually with BPC 157.
Oh, perfect.
So go ahead.
So thymosin beta 4, sometimes it's called
TB500.
TB500. It's the same thing. One's generic and one is not. It acts on the thymus gland to help stimulate your immune system to work a little bit better.
Okay.
Helps to increase the T cell activation in your body. But this one, the thymosin beta, the reason that we're taking it is not so much for the immune system. That's not necessarily, it heals soft tissue. So we're taking it in along with the other one, the BPC 157, so that we're healing the ligaments and the muscles, and then we're also helping to heal the soft tissue with the thymosin beta. It
Cool.
has a longer half-life, so you don't necessarily need to use it every day. Like the BPC 157 has a shorter half-life, and so you can definitely use that one every day.
And you're doing that more systemically, right? So you're going to do that just in a general area, like the subcutaneous fat.
We mix them. So
We'll mix
BPC
them,
157
Okay.
and thymosin beta will go into the
In
same
the
thing.
same
Oh,
syringe.
okay. So you might
Sure.
put that both in your ankle or your shoulder or whatever
Mhm.
you're trying to stimulate.
Yeah.
Exactly.
Or, I mean, you could just do it all sub-Q in the abdomen, but, when we're
Cool.
mixing it in the same syringe, I'll do it in the acupuncture points.
And say someone's just doing those,
Uh-huh.
thymosin, beta 4, plus BPC 157. Would they see any weight loss results with that? No,
probably
not really. Okay.
No.
No.
But maybe if their injury got better, they're able to exercise.
Exactly.
There you
Yeah.
go.
Maybe, maybe.
Absolutely.
Yeah.
Okay. So now let's jump to thymosin alpha.
Also from the thymus, also a T cell inducer, so it boosts up your immune system.
Stimulates
you
your
know,
B cells to go
yeah.
out there and produce antibodies.
Yeah, that's one of the end products of it. The geeking out a little bit, in inducing the T cells, it actually helps with antigen presenting cells. So the major histocompatibility complexes, which I know you're kind of familiar
Yeah.
with in the nutritional world.
Sure.
But it actually upregulates your MHC1 complexes so that they optimize the way your cells present antigens to the rest of your body, as well as the toll-like receptors, which also do similar
Right. right.
function, so that you get better antigen presentation, so that your immune system recognizes things better. So all in all, it just upregulates your immune system. It helps with cytokine regulation. It's an immunomodulator, and it's smart in that it upregulates and downregulates as you need it. And
nice.
most of us are in a point right now where we all really need a little bit of upregulation
Sure.
of our good immune function, not this mass inflammation that we kind of induce ourselves with through our lifestyle, diet, electromagnetic field exposure. That's a whole nother podcast for a whole other day.
We can geek out
But-
on that too.
Yeah,
We're going to have
we
multiple
could-
ones with you guys. I
we could
tell,
probably
so.
geek out on that forever. But anyway, so it actually is smart enough to kind of know what you're really needing. And for us right now, it's upregulating a lot. And Natalie found out that, we just take it as kind of prophylaxis because we're not sick. We don't have
Sure,
COVID. We
right.
don't have, we're not necessarily have a big viral load or anything like that. So we're upregulating our immune system to just try to optimize everything. But she found out that you can actually do it if you start to get a cold or you start to get a little illness. You think you're getting, whatever it is. If you start taking it, you can also help shut that down quickly as well by upregulating. So
that's awesome.
Yeah. So we're just taking prophylactic. Not really, but it's really good for people with chronic fatigue, Epstein-Barr based things, fibromyalgia. It's being studied for use in cancer. It makes sense, right? If it's increasing your immune function. So a lot of those bad, nasty viruses, it's looking like Lyme disease, that Thymosin Alpha is a pretty good player for that.
Nice. Well, it sounds like any kind of person with autoimmune disease would have some benefit. Are you seeing more and more physicians using it in the functional medicine circles?
It's funny that a lot of these peptides were originally studied on HIV patients. So it was a lot of the original studies. And I was like, well, that's very interesting to me. But yes, it's being, Thymosin Alpha is probably one of the more popular,
especially now
because it's
COVID.
FDA. It's one of the few that are actually FDA cleared.
Oh wow!
Now it's FDA cleared. A lot of oncologists are using it in various ways to either aid with some of the other therapies they do for cancers and stuff like that. But it is actually, there's a product I forgot. It starts with a Z that is FDA cleared for that indication.
That's cool.
So, yeah,
that's cool. So what would be like the youngest patient that would use something like Thymosin Alpha?
Oh, that's a really good question.
Depends on how immunocompromised they are, I suppose.
Right.
I mean, I don't know that your average kid that's below 25 or so really hasn't started deteriorating yet because their mitochondria are still good. Don't have enough mutations in them, so they're repairing well enough.
Right.
And so they should be functioning pretty well.
If one of our children, say if they were 16 or whatever, and they got strep throat or something, I would definitely use it.
Right. Okay.
We don't treat kids in our clinic.
Sure.
That's a good
so
question.
that would be up to a pediatrician. But
yeah,
say if a 16-year-old, 15, 16-year-old was like, yeah, I'm coming down with strep throat, I get it all the time.
Well, he's thinking about his kids, so I know what you're thinking.
Well, and any way we can help them. Of course, their immune system's still developing, and it still will be for some time. But yeah, just thinking about for kids that maybe that have some chronic autoimmune issues that people can't figure out, or maybe I'm just thinking that maybe this can stop some of that. Give their immune system some help to bind to some of these antigens and bacteria components that our immune system is supposed to bind to, but it's not. So cool. I like this one. I'm going to research. All of these are awesome.
It'll probably take a little while to research it on children because, again, it's one of those that, we start with the rats, and then if it's looking pretty damn good, we go to the humans, but we go to the adults, unless it's specifically designed for children. So nobody's gotten the gonads up enough, I think, to start testing this stuff on their kids and stuff.
Or pregnant women.
Actually, I take that back. I bet there's somebody out there who's probably doing it on their kids.
If one of my kids had leukemia and they were 8 years old or something, I mean, I'm sure they're...
At that point, why not?
Yeah. Sure. Awesome. All right. Let's jump to FOX04.
Do you want to start talking about FOX04?
You go ahead.
So FOX04 is awesome because, in a nutshell, what it does is it goes in there and it tells your senescent cells, your old lazy cells that have decided, I don't want to do anything anymore but sit in my recliner and sit here. So that cell, instead of doing processes that help the body and do the work, say like in a household, it just decides to sit in a chair and take up the oxygen and take up the food and take up the water and excrete toxins, but it doesn't do anything to help out with the community, right?
Right.
So you need to kind of get in there at a cellular level and just tell that cell it's time to move on.
Wake up.
You can wake it up or you can take it out. So in the body, you get this huge load of senescent cells that aren't doing their job. They're taking up space in there and they're taking up resources. So you need to go ahead and at a certain point, you need to get rid of them so that then your body has room and resources to make new fresh cells that work better. So FOX04 actually will go in there, and it's not the FOX04 itself, but it's a FOX04 derivative. So they tweaked it a little bit so that it goes and sits on the receptor and because FOXO4 in the body, our natural one, will help the senescent cells to live a little longer. So the natural FOXO4 will be like, yeah, you can hang around a little bit longer. The one that they've tweaked a little bit and they've modified it, it's a dextro isomer. It goes in there and it sits on that receptor. So now the other FOXO4 can't sit in the receptor. So now it's preventing that one from saying you can live a little longer. So it's like, nah, it's time to move on. So it helps apoptosis, apoptosis that helps for those cells to die. So that then you clear out the junk in your body. And the older we get, the more junk cells we get. And so you need to clear them out. In rats, it's actually been shown, or mice, that it kind of reversed the hands of time as far as their body and their health. It brought back their kidney function, and it actually brought their fur density up dramatically. So I was like, oh, I wonder if it'll do my fur density.
Right. So for patient types for this, this is just for more of an older patient, maybe less motivation, gaining weights, right? What kind of, how'd you describe it?
Probably not so much with weight.
Okay.
It's just this one's more for your anti-aging.
Anti-aging, okay.
For longevity.
Aesthetics, okay.
Well, aesthetics as well, but it's main when it's just like, say, hey, if you're 50 years old and you want to live a long, healthy life, you're collecting all these senescent cells in there, and you probably need to go ahead and clear them out, get rid of them.
Yeah, the body's natural processes, and the reason we have senescent cells is because of, primarily, at least the theory is, mitochondrial dysfunction, right? So as mitochondria has its own DNA, and I won't get into a long talk about mitochondria because I could do a 3-hour talk on just that alone. But the Reader's Digest version is that the mitochondria, through oxidative stress, it has mutations in its DNA, so it doesn't repair as well. So it's kind of like that Ferrari you alluded to earlier, and after you just kind of run and run and run and run, after a while, it's just not quite as peppy, and it slows down. So it slows down, and it becomes not so dysfunctional that the nuclear DNA says, hey, we're done, this cell's, we're toast. You know, body, come in and take care of this cell. It just sort of sits there in a quiet state, just lowly humming and taking up energy, causing inflammation, and it just sort of hangs out there. It's not really functional. It's functional, but it's not really optimized.
Sure.
And it's creating more problems than it's actually helping with at that point. And what the FOXO4 DRI does, the dextroisomer of the FOXO4, is it does exactly what Natalie said. Our normal body, it uses FOXO to kind of, it preferentially likes the senescence. And so we kind of stop that with the FOXO4 DRI so that it kind of goes, oh, wait, this is dysfunctional. Let's take care of it. I don't know that it really wakes it back up as much as it just says, hey, look, this is dysfunctional. Let's fix it. And the fixing is not just simple autophagy. That's more of a day-to-day, what our healthy cells are hopefully doing by getting rid of all of that crap. It's the true apoptosis, or apoptosis, depending on how you want to pronounce it. But so the
pre-programmed cell death.
So it kills the cell. The cell dies, and then it's
the bad cells.
The senescent cells that aren't functioning, not optimal for the body. And then there's signals that would go along with that say, hey, body, we've lost some cells. Let's make some new cells. And now you got some healthier, newer, theoretically, newer cells.
You're going to trade in your old Ferrari for a new.
Yeah, getting a new Ferrari, new oil change for that Ferrari.
Exactly.
Yeah, so it sounds like maybe this is for someone a little bit older, maybe 40s and ups.
Yeah, probably 40s and up.
That would start doing this one. Okay.
Yeah. And then you don't continue to do that one. You just do maybe 1 or 2 cycles a year of that, just to go in there and clean house. And then you just leave your body alone, and then maybe in 6 months or to another year, you do 1 more round and you clean house. It just helps your body to function optimally.
Yeah, like everyone does a detox, a couple times per year. It's kind of like the same kind of process.
Exactly. Yeah,
more accelerated.
Cellular detoxing.
Right.
This is more of so if you fast for a week, right? We already know that autophagy and apoptosis kind of kicks up,
right?
Just from fasting. This sort of accelerates that. And I haven't experimented yet with using it and fasting, so don't ask that question because I saw it coming. It's sort of like fasting without fasting, sort of. I don't want to mislead any of your listeners, but it's sort of like that.
That's awesome. Very cool. All right, let's go into DSIP.
All right, you want to start with DSIP?
Yeah, so DSIP is the deep sleep inducing peptide, and again, one of those mechanisms that's not very well worked out, but what we know is that it's not a sleep promoter, but when you do fall asleep, it does help you get down into that deeper delta sleep. So, and delta sleep is where your repair, it's not the REM, it's your deep sleep. And that's where most of your reparation comes from. You're in a very parasympathetic state during that time. So cellular repair and stuff is optimized during that time. And this helps you get more deep sleep. And that's one of those things too, that like we have our Oura rings, and that's how we track our sleep, to kind of know where our deep sleep is. And I've noticed when I use it, I get better deep sleep. When I don't use it, I don't get quite as much deep sleep. So, yeah.
Now you can use it for other things.
That's true.
It's been studied for about 40 years. But for us, that's why we're taking it, is for the deep sleep. But it can help with people who are going through opioid and alcohol withdrawal, just to kind of help mitigate the symptoms from it and help them handle that. There were other couple of things that it did in the brain. Decreased inflammation, helps with pain. That was another one. So chronic pain.
Because you're sleeping better, right? So everything's going to be
help
probably with that, of course.
Yeah. So, you know, if we had somebody with really severe chronic pain, that's probably one of the ones that we would prescribe for them. Again, we're just trying it to see if it helps the deep sleep, because which one of us can't use more deep sleep?
I know
in
I
our
could.
modern,
I could.
especially with little kids, a baby.
Right. Yes.
Yeah. And I'm not sure if that's the GABAergic or the glutamatergic. I'm not sure.
Well,
I can't remember.
in the studies, they said they actually really don't know the mechanism of action. They've been
true.
studying it for years, and it's super complex, and they're not still really sure how it works. But in studies, that it did have these positive effects.
Nice.
And really, really helpful for alcohol and opioid withdrawal. And
this might be a dumb question, but is this one of those peptides that you take before bed?
Yes.
Okay.
Yeah.
Perfect.
And you should probably take about 2 hours before bed, because again, it's not that it's you take it and immediately causes you to fall asleep, but you take it for a couple hours before. So then you go to bed, and then after you fall asleep, it's had time to start working and then help just facilitate you to get into that delta sleep.
Right. And it's not going to shut off your body's natural production of melatonin or
well,
anything like that.
No, but you could have tachyphylaxis to where you get to where it's no longer working, so you don't use it daily. So if you want to use it frequently, every other day, so that you're not getting the body where it's used to that peptide being there and stop working.
Awesome. We're going to talk about the next peptide on the list. We're going to talk about Semax, and that's a nasal spray, correct?
Yes.
Okay. Awesome.
Awesome. You want me to talk about that one?
Sure. Go ahead.
All right. So Semax was actually discovered by the Russians, and during the Cold War. So we didn't find out about this one as quickly as they did. But what's really cool with that is it increases your BDNF synthesis in the brain. So it really helps get more nerve growth and more regeneration. What's really awesome is that it helps to stop clots in the brain, or if you get small, tiny clots, it can actually have a fibrinolytic effect. So it's good for people with TIAs, for strokes. It's also been shown to help people with Alzheimer's, Parkinson's, ALS. Okay. It improves your memory, cognition, your ability to learn, and it increases the blood flow to the brain. So people who've had injuries to the brain, like traumatic brain injury, it's super awesome for that. And so Doc's been using it. I'll go in there and sneak a little squirt every now and then if I'm trying to write my articles for the day. Super awesome. I'm really excited.
Is that almost considered like a nootropic?
Yes, it is. Definitely.
Neuroprotective.
Yeah.
And we're not going to talk about genetics today, but if anyone had like an ApoE34 or 44, for instance, would they be a candidate maybe for this?
I would say for sure. Yeah, if I was ApoE4, I would be definitely using the Semax and the DiHexa.
Yeah.
For sure. Awesome. I mean, and he's not ApoE4, but with the traumatic brain injury.
Right. For anyone who's like been a football player, maybe has CTE.
Concussive head injuries.
Right.
Absolutely.
Well, and even somebody with ADHD. That's helpful. So if someone doesn't
so a kiddo can do it, right? Or
So if they don't want to go on some, pharmacological drug, this is a good opportunity to take something a little more natural to help your brain function a little bit better.
Wow. I want to take some right now.
I know, right?
Kind of makes you want to.
I should have brought some. We could all just squirt it.
There you go.
Then we'd be here for 3 hours, right?
Yeah.
Awesome. All right. I think this is the last one on my list is DiHexa Topical.
DiHexa.
It's very similar. I mean, it has a lot of the similar effects that the Semax does. you know, and I believe the Cmax increases the neuromuscular function as well. So kind of the way the nerves and the muscles interact, and it actually improves that neuromuscular function. So so I thought it was kind of interesting that, and then DiHexa does a lot of the same things. You know, do you have? I mean, it's pretty much, to me, they're synonymous, except for
very, very similar.
One you snort and one you
one you rub on. With the end result, what I thought was interesting was just that when you're reading the studies on the DiHexa, it talks about knowledge acquisition and compilation, and then being able to use it. I'm sure probably the Cmax does the same thing as the DiHexa, but the studies didn't use those words. I was like, ooh, the acquisition of knowledge. I like that. Being able to not only get that information in and then consolidate that information so that you put it together and it sticks, and then to be able to use it. So he's using both. And again, they do have.
Look how smart he is, right?
I know, he's such a genius. So, and it also helps to repair. So people who've had TBI, someone who's had some incidents where they had hypoxia, anything where there was damage in the brain, or if you just want to get smarter and you need a little help.
Sure, of course. So this operate for nerve pain like a gabapentin would as a topical agent, or is that a little bit different?
I don't know that it has GABAergic effects. The studies that I looked at don't say anything about the pain.
Now, because it helps to regenerate nerves.
It is regenerating nerves, so it stands to reason that it could help with that a little bit. But I don't remember reading studies that related to that. It was more of the nootropic effects, and how and the decreased neuroinflammation and neuro repair, and it was all about, kind of, to me anyway, the way I've categorized it is sort of, that's my nerve, it helps my nerves in the brain.
Sure.
But if we're talking about peripheral nerves as well, I mean, that could be. That would be something interesting to look into. Like if someone has peripheral neuropathy, or some sort of nerve pain or reflex sympathetic dystrophy, it'd be awesome to see, if that would help a little bit, rub that cream on.
Right.
It'd be worth a try, because it sure can't hurt you. Right. I mean, unless you put the whole bottle over you, and then even then, I don't know what the side effects would be for this.
It's not going to hurt though, right? I mean,
it shouldn't.
And nerves regrow super slow, like 1 millimeter per month. So maybe this can help get a little bit faster. And I know like when you get an injury, sometimes those nerves get impacted, and then you're starting to heal, but those muscles still aren't activating. They're not firing correctly. So maybe something like this might be able to help. So.
And I would say with anybody who had any sort of head injury, even a small head injury, you fall off your bike, you're in a car wreck, and you hit your head on the back of the seat rest, I would say get on these 2 supplements, peptides, instantly, because you've got some inflammation in there, you've got some swelling of the neurons, and you want to get on top of that.
Right.
And the BDNF is important, and we know that the DiHexa is about it's a 7-fold increase over what your natural BDNF production is. So you get a lot of brain-derived neurotropic factors.
I'm like, wait, that's a mouthful.
So anyway, it is helpful in that regard.
Awesome. Very cool. Well, we went through a lot of peptides today.
Yeah.
And we're going to have to put some lengthy show notes for all these descriptions. But can we talk about maybe just for general, like someone who's listening here and saying, whoa, I want to do all of those. Like, where would someone start? And of course, we need to see a healthcare practitioner. And also, what kind of cost do they assume by doing a few of these therapies?
I think the first place to start would be come see a practitioner who has experience with peptides. So, because it would get overwhelming if you're listening and you think, I want to do them all. Right. It could get quite pricey.
Sure.
And it could get overwhelming. And some of your listeners may not. I mean, they're people younger than us, older than us. They might not need the same thing. So go see a practitioner who is experienced in peptides, who could then take your history, look at your labs, figure out what are your main complaints, and then design a peptide recipe for you specifically, so that you're saving money. You're not just taking everything in the kitchen sink is where I would start.
Right.
Yeah, and there's different peptide stacks for different, kind of application.
Sure.
For what do you want to get to? Because, if it's somebody that's just got that little extra midsection kind of thing, and they don't really care about repairing brain cells and stuff, then they wouldn't need the DiHexa and the Cmax. We would go with CJC Ipamorelan and maybe AOD 9064. It's a whole different one. I'm sorry to bring up a different one. So
it's okay. Yeah.
Those would be the 3.
So there's more than this, obviously.
Oh, yeah.
Yes. Right. Of course.
Yeah.
Awesome.
And then as far as cost goes, if you bought them from overseas or, you could probably get it for $50 to $75 a vial, but then you don't know what you're getting. So, I don't know, you're probably looking at more like $150 a vial, depending on what you're using.
Yeah. And then
not bad. Yeah.
And if you're using multiples, I mean, you can go from, $100 to thousands of bucks a month.
Right.
I mean, depending on what you're trying to accomplish.
Trying to achieve.
And those aren't continuous costs because you do cycle. Some of them, Epitalan, you only use maybe once or twice a year. Again, I introduced another one. Sorry. But Mot-C would be another one that you would only cycle with. We kind of inferred that with the Thymosin beta, you do cycle a little bit with it as well because it's got such a long half-life. And so, it's different. And so the cost, there's no way to really go, oh, it's going to cost this much every time you come. It's impossible to tell.
I'd say you'd be safe to say probably anywhere from $100 a month up to
$700 or $800 a month.
I was going to say probably $1,500 a month.
It could be. I mean, if you're doing the full stack, which that's
right.
Yeah. And then there's a lot more than that. So we only take about 9, 10. 11, about 12 or 13 different peptides that we use right now, which is kind of pricey,
right?
But there's a whole laundry list more of that, so
right.
You can really start getting a lot Guccier, and but the beauty of it is you can specifically tailor it to what you're trying to accomplish,
right?
So and that's so it can be at low cost if you're looking for one thing, or if you just want the whole generic, holistic, all body, optimization. And now then we get into exosomes and stem cells, again, a whole nother podcast. I mean, that's a whole different deal.
Right.
But,
But the good thing is you don't typically need to have exosomes and stem cells every month. And the same thing with a lot of the peptides. You're not always going to be using them all every month. So,
And I think it goes back to anyone listening. Go to the healthcare practitioner. Go see a trusted physician who's been doing this, who has the knowledge, like the Dr. Ledbetter's here. Don't just go buy some off Amazon. I don't know if you can do that, but don't go buy some just willy-nilly. Really try to figure out your labs, test, don't guess, right? So, we're just giving you information here, guys. So, definitely go see a practitioner first. Awesome. So, one question I want to ask that's not peptide related is, what is the health-related product, whatever that means to you, that's been under $150 in the past 6 months that's had the biggest impact on your health?
I'd say
I think we both agree.
NMN.
NMN.
Yes, for sure. That precursor to NAD.
Nicotinamide mononucleotide, absolutely.
You just put it underneath your tongue and it helps to get that precursor to NAD in your body. And I think that the energy that you get from it, the clarity, the ability to feed the mitochondria so that your ATP production can be accelerated is been awesome.
So you guys have gotten there recently and noticed some results, like with energy and mental clarity with it, or?
Yeah, within the last 3 months maybe?
We've been taking it for a while, but I mean, it's
we've been taking the NR and then you just got I like the sublingual NMN.
NMNs,
because it doesn't have that first pass effect. Your liver's not taking it up. You get it right into your bloodstream. And if I get a little crazy and forget how many I've had and I take another one, I notice I'm like, and this is blood. I see people's face like,
right.
Oh yeah.
And you can get that from
you can get that online.
Get it online. Okay. Very cool.
And I was going to say on my website, drNatalieLedbetter.com, I may have a link for that one. I'm not sure. I know I have one for the true Niagen, which is the NR, which is also a precursor to NAD.
Right, but this is the NMN.
Yes.
M&M. Just call it M&M.
M&M.
I have to say the whole thing. Nicotinamide mononucleotide. Otherwise, I get
sublingual tablet. Okay, perfect.
Yeah,
I
think it's Alive by Nature. Is that the brand that we've been getting lately?
I have no earthly idea.
There's a couple.
We'll put a link to it in the show notes.
Sure.
If you're interested.
Yeah, that sounds good.
And so this is a question I'm pondering for you guys, because y'all have so many great tips and tricks. You kind of live this life of wellness. If you had to just tell listeners, if I could create a billboard with 1 or 2 health tips on there that we should be doing to maximize longevity, life, etc., what would that be?
I think probably, for me anyway, and she may have a different answer, but you got to eat right and exercise.
Right.
I mean, we know
basics.
We've got all of this fun stuff that we do, you know, hyperbarics, and we do PEMF, and we do ozone, and we do all of this fun stuff. But if you don't eat right, and I'm sure Natalie will dig into it because she's very big on the diet stuff as far as, you know, grass-fed and grass-finished and organic and free range. And the joke around the house is you know, she'll say, you know, something, and I don't care what it is. It may be the stool or whatever. And I was like, well, is it, you know, free range, grass-fed, grass-finished, and no hormones, no antibiotics? And it's like, oh, it's just a chair, honey. I'm like, yeah, whatever. But as long as it's grass-fed, it's okay. Anyway, it's a joke around the house. But I would say that all of the studies that we know, from as far back as they go, good diet, putting the right nutrients in your body.
Yeah.
And again, you can get into the farming practices and all that stuff because there's a whole lot. That's a whole nother podcast just in itself. But then exercising regularly,
Right.
creating that little micro stress on your body on a regular basis, so that the body knows that it's got to be in a good repair kind of mechanism all the time. It's just, we know that those 2 things are probably the key to everything. So you can do peptides all day long, and you can do ozone therapy all day long, but if you're not eating right and exercising right, you know, it's kind of like pissing on a forest fire, right? I mean, you're going to get a little bit of the fire out, but there's still that big old forest that's still burning, right? So, you know, you gotta kind of, you know, do the right thing, the big things first.
Right.
I mean,
that's the low-hanging fruit, right?
Right,
I mean,
exactly.
It's so not sexy, right? To be like diet and exercise. People are like, oh, we wanted something exciting. But like you said, if you do all of these other things, but you're not putting good quality foods, we are what we eat. We are. The Chinese have said this in Chinese medicine since thousands of years, that what you eat, that's what our bodies become made of. So do you want your body made out of plastic fats?
Sure.
Think about, if we put saran wrap all around you, would you function very well? Could you breathe? Could you excrete? Could you intake? Well, that's what we're doing to ourselves, because we're eating plastic fats, canola oil, soy oil, all these fake vegetable oils that have been hydrogenated. So we're putting these plastic fats in our body, and our cell walls are being made of plastic fats. And so then it's like saran wrapping them. They can't bring in products. They can't excrete products. They can't do their jobs. So it's huge, diet and exercise. And then exercise, we were in a phase in our life where we did everything, the diet and all these fancy things, but we were so busy working that we somehow couldn't find the time to exercise.
Right.
And we kept saying, we have to exercise. We know we need to. We know. And for his brain, for his TBI, the #1 thing you can do for your brain is exercise. And so no judgment out there to people who are like, I can't find time to exercise, or I'm too tired to exercise. Because we were there for a while, and finally it got to the point where we're spending our discretionary funds not on going out on dates and not on buying new cars, but on taking care of our health. And you hit a brick wall, and you finally realize, I have to do the foundational things. We were already eating right, but we had to add in the exercise. Now, the cool thing about adding in the peptides and the NMN and the NR is that it gave us enough energy to get over that hump of like, oh, I'm just too tired. So then you have a little bit of energy, you go out there, you start exercising, and then you realize, oh, I didn't die, and I feel good. Well, let me do it again. Right. And so now it's got to, we're going to go running the trails today. And I used to say, oh, we have to go running today. And now it's like, oh, we get to go running today.
Right.
Because we feel like $1 million afterwards. So some of the things that we're doing gave us that little extra energy. So if somebody out there needs help, they can do things like come in for an NADIV or take the NMN or the NR,
right.
Some of the peptides that give you just a little extra energy so that you can take that move, but you have to get out there and exercise. In Chinese medicine, stagnation causes pain, cancer, and the #1 cause of stagnation is sitting in a chair.
Sedentary lifestyle.
Right. Yeah.
And just to set realistic expectations too, it's not it's a slow burn, right? I mean, it's not I took the NMN and I got some peptides, and today I feel great, and I'm going to go make myself 20 years younger. It's a process. So everything's a process. Right. I try to really work hard to set realistic expectations for people, because no matter what comes out of my mouth and no matter how realistic I feel like I'm setting them up for it, I still get the calls pretty regularly. It didn't work. And I was like, it's been a week. It's been a week. What do you expect? I mean, so it's a slow burn. It's a process, okay?
And
months, and like I tell Natalie sometimes, I did all this damage in 54 years. It's going to take some time to turn it around, right? It's like, and being a Navy reference, the aircraft carrier's cruising along at about 30 knots. It doesn't just turn around like a little bitty boat does.
Right.
It takes a long time to get that sucker to turn around and go the right direction. So, So I don't want anybody to misunderstand what she's saying, that yes, we feel great now, but it's been a process.
Right. Health is a marathon, not a sprint.
Exactly.
Yeah.
Awesome. Yeah. Well, we're definitely going to have to do this again. I mean, I already have 2 or 3 topics that I've written down that we could talk about. Part 2, another time with exosomes.
Oh yeah.
Maybe some other peptides. We get some interest in that. And but just, you guys now have 3 or 4 clinics, right?
Yes.
In the Austin area. Just describe where people can find you guys on social media, websites, etc.
So they can look on our website, lalongevity.com, because our clinics are L Aesthetics and Longevity. So longevity.com is our website. Also, you can find me on drnatalieledbetter.com. For our Facebook, it's L Aesthetics and Longevity. Or also for Instagram, it's L_aesthetics_longevity.
And aesthetics is spelled A-E, not just E. Yeah, AESTHETICS. So.
And then drbillyledbetter.com, drbillyledbettermd.com will be up and running soon. It's just in the phases of being put together.
Getting built, yeah.
Awesome, guys. Well, always a pleasure speaking with you guys. You guys are a wealth of knowledge, and I hope to do this again with you guys soon. So thank you guys for tuning in. Please subscribe for more information. And
thanks, everybody.
We'll talk to you.
Don't you know?